There we go. So yes, welcome everybody. Today is the first of a series of webinars that will be taking place on the second Wednesday of every month. Today's session is about grounding techniques. So we have Mike Scanlon and David Smart with us. Mike is a retired clinician and mental health educator, and David is the clinical director of Worth GPA, and he's also an ex-GP. So we are recording this session, and there will be a Q&A towards the end as well. So if you do have questions, feel free to pop them in the chat, and we will get to them at the end. So I'll hand over to David and Mike and get started now.
Thanks very much. Thanks, Joe. And that initial slide, we're better when we're grounded, I think really it is so true at the moment, because my guess is, and what I hear and my recent experience just before sort of having my last day in primary care, as it were, is that actually primary care is probably a more convoluted, difficult, stressful place. And there's a degree of moral injury going on within an awful lot of settings for a great many staff. And it's just a really high pressure time. And during high pressure times, I think it's incumbent upon us to really take that urge to look after ourselves as well as possible. And sometimes my own experience was that it can feel like you're on a roller coaster of emotion. And a roller coaster of just so many different people's issues and stuff and difficulties and complexities. And if we're not careful, we sort of find ourselves being tumbled along like the sort of tumbleweed in one of those old westerns, you know, and we find ourselves tumbling through the day without ever stopping. And there is something really important about just stopping and grounding ourselves. An example being on this first slide, which just kind of takes us through and of a scenario, I suppose, that some of you may well recognize, and I'm sure Dave sitting there will have been in this similar situation where you're consulting with a really complex client patient, and while listening, suddenly a question outside of our expertise is asked, and it's sort of, sometimes that can be really a little bit sort of unnerving, because you know clients almost expect us to have all the answers, and there is that weight of expectation that sometimes overwhelms. And while planning to answer the question, this GP's heart starts racing and anxiety shows up, and the realization that anxiety has shown up doesn't help with the heart rate or the heartbeat. So Sam actually decides to do what usually helps, to just focus on the breath and deliberately on purpose take some steps to slow it down, and to make sure, really simply, from a very scientifically led position, that my exhalations are just a bit longer than the inhalation, just as simple as that. And at the end of our presentation tonight, at the end of our chat together this evening, I have included a reference for a really brilliant piece of research that just explores the importance of the breath in this sort of scenario. Very quickly and soon after, Sam will notice that the heartbeat's normalized, the tension's dissolved, and by just slowing down that breathing rhythm, very gently shifting to a longer out breath, we trigger that whole shift in our bodily symptoms. And then we get the activation of the parasympathetic nervous system. And with that becomes that calm and the all-important grounding. David.
Mike, I mean, this is spot on. I mean, I was on a call with our current RCGP president the other day, and she was just saying general practice now should carry a health warning. And that's really? A really stark reminder of our president actually saying that what you've just said at the beginning is actually spot on, that, you know, we need to really recognize that the pressure on GPs. And this is just such a lovely example of what I used to do in general practice, just between patients sometimes. And as you're saying, even in a consultation, and practicing that longer exhalation. 7-11 is what we used to do. I don't know whether that's relevant now, Mike.
Oh, it is. Yeah, it's just that longer exhalation. I think the newer stuff seems to be saying that, you know, sometimes the counting almost complicates it, because I remember watching 7-11 being taught once and not being taught very well, and they were teaching it that it was 7 and 11, but they were doing sort of 7 full seconds. And if you ever try and breathe in for 7 full seconds, about half the population of primary care expire, you know, because
yeah. So what you're saying basically,
it's 7 counts and 11 counts out. So just making sure that the exhalation is a bit longer.
So what you're saying is just keep it simple, just make sure, just breathing out longer than we breathe in. And that's the main thing, not to focus on numbers or anything else. That's really helpful, and keep it simple. But it's incredibly powerful though, isn't it? I mean,
it really is. Yeah.
I mean, I had one lady who couldn't cross the road. She's agoraphobic, tried this. She got across the road, and then she actually ended up booking a holiday. And she ended up singing on stage just because she just ended up just being able to overcome this central panic that was stopping her. So yeah, really good example.
And I suppose there's something about modeling process as well, isn't there? That if the GP is noticeably just taking time to slow and to breathe, and then that's, you know, we're modeling the process we need our clients to be doing as well, which is powerful in and of itself, because you guys in primary care are such role models, you know, and there is that sort of thing. Well, if that's what he uses, then it's going to work for me too, or she uses. There's something about that.
Brilliant.
And sometimes we need to go a step further. And the next slide sort of takes us into the brief mindfulness. And this has changed so much over the last few years, because when I was first taught mindfulness and I did my my course in becoming a mindfulness teacher, and at that time, there was such a lot of research that talked about mindfulness being, here we go, huge medical model in inappropriate use of, like some people would say, dose effective. I remember lots of research saying that there's a real, you know, and there is, the longer we meditate, the greater the benefits. However, in today's world, the amount of people that are going to be willing to sit and meditate for 40 minutes feels to me like it's a shrinking number of human beings that can just find that level of time. And in a way, we get into this sort of paradoxical effect of becoming stressed because I can't find 40 minutes. And paradoxically, well, that doesn't work at all. We are better, for a great many of us, to accept the newer findings that as little as 5 minutes of just stopping and bringing ourselves into the present moment, and any 5-minute practice that works for you can actually increase what we call this state mindfulness, which is, and that's where we go to ground. And if we look, the one that I have taught for some years on the next slide and advocated for primary care is this one. And this I think is almost one of the go-to meditations. And that link there, the wonderful Joe will send out tomorrow in a PDF. So if you want to, it's one to use. And a lot of GPs that I've worked with, I've seen quite a lot of GPs who have come and wanted to talk about, you know, the just how difficult things are. And we've sat and we've talked. And I've said, you know, the thing to maybe take away is when you do finish a consultation with a feeling of unsettled or unnerved, or you sense an uncomfortable sense of hurry up in self, that might be the time to just quickly send a message through to reception, say, I just need 5 minutes. And the 3-stage breathing space is interesting, because if it had a shape, it would look like an hourglass, because what you do with this, I won't do it tonight, but I'll talk you through it. I think that works better on these sorts of presentations. Is it has this sense that you start off by just centering your attention with listening to the sounds outside the room, the sounds in the room, then finding your breath, and then asking this great big brave question. So what's going on with me at the moment that I'm struggling with? And that in itself is incredibly powerful, because as human beings, we tend to go, oh, not thinking about it. And every time we go, oh, I don't want to think about it, we're pushing down stuff that eventually has to come out. So what we do with the 3-stage breathing space is we go on then. So what's going on with me? And we let it all in, a bit like that Rumi poem, The Guest House, and we let in whatever wants to come in, whatever guest, thought, feeling, difficulty wants to come in. And we learn to sit with it for literally 30, 40 seconds. And we label it just this. Yep, just that. Just tired, just stressed, too many people, just annoyed, just difficult. And then we let go and we narrow our attention purely to the anchor of our breathing. And we stay with the breath until we just feel that sense of back in the moment and a dissipation of that stuff. And then in the final section, we broaden out again and we just say, and let's just take all of this quiet and let's just get a sense of moving on into the next part of my day. And I do cope. Right here and now, I'm in the surgery and I'm coping and I'm okay. So we move from narrowing of attention to focus ourselves and create that centering, letting it in, closing it right into here, using the breath to anchor our attention, and then the reality, which is I'm actually okay. I'm functioning. I'm here.
Mike,
And that takes 5 minutes.
This is fantastic. When I've had anxiety and I've had times, and
me too. Yeah.
What I used to do was actually do exactly what you said. Just lock the door, phone on, do not disturb. I'm going to have 5 minutes for me, and that was one of the best things I did. And I've practiced mindfulness, but this was the best evidence-based. Or just nip to the toilet. Nobody can get you there, and just get some escape. Just sit there and just do this 3-minute breathing space, and that really worked for me. But just it's getting that space to stop, and the number of times you just able then to come back to next consultation, you're present, you're there, you're not bringing all of the other baggage with you into the next bit of your day. And I used to, really, this was my go-to. So I really can't recommend this enough for you out there.
Mine too. It's my favorite. There's 4 of these breathing space meditations, but this is my absolute go-to. There is another nice one, which is a breathing space with action step, which might be, if people are interested, that's a nice one to listen to. Jon Kabat-Zinn, there's a lovely one on that one, but John does nothing quickly. A Jon Kabat-Zinn short meditation is sort of 12, 13 minutes. I think for primary care and for you guys, we keep it to 5 minutes. And this one on this recording is about 5 minutes. And you know what? That works.
Yeah.
The YouTube link is no longer available. We can make sure it is available. So don't worry, we can, that'll just be, it just needs a refresh, but we can sort that. I can refresh that, Joe, and send it to you for tomorrow. So when we send out the PDF, I can make sure that is working. So
thanks for that attention. That's great.
It was working, but this is the nature of the internet, I suppose. And the next one, which I think works also, is a 5-minute meditation. And it the title of this one says it all. This is called your drop anchor meditation. And it's a sort of variation on the grounding technique that I've been teaching people with PTSD for years. The just stop and 5 things you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell and 1 thing that you can taste. And we've put it into a meditative process. And what it does is we center our attention, and then we literally drop anchor. And ideally what you finish with, and it's a lot of the newer research into pain, working with pain, which we call somatic tracking, which is when you drop anchor, the message you're giving to self is, I've utilized all 5 of my senses and I am safe. And just finding that kind of I am safe when 3 minutes ago we weren't feeling particularly safe is huge. And it is just finishing off. And sometimes it's, my name's Mike Scanlon. My faculties are kind of working pretty well. I'm loved, I'm liked, and I'm okay. I'm safe. And we drop anchor and we just find the real core facts about me. You know, it's a Wednesday evening and I'm okay. And the brain loves that, you know. So when we drop anchor in this way, and what I think is really important is have a listen to the 3-stage breathing space with difficulty, have a play with the drop anchor meditation. And I always say this, find out what works, be comfortable why it works, the science of it, which we're kind of touching on, and then do more of it. Find out what works, why it works, and then just do more of it. And if we're doing more of it, we are grounded clinicians. We are looking after ourselves. And for me, and I hope for you guys, that matters so much. And over to David.
And Mike, that's such a key point, that just dropping, and just these are quick meditations that you can do between patients. And I think that's the key thing. The 5, 4, 3, 2, 1, you can do anywhere, and great on a walk as well, just to stop for a moment. But these are things you can take with you. And this is what we want you just to do it anywhere. And it is the practice that matters. So doing it, and as you said, John Kabat-Zinn said, you need to weave your parachute daily. You never know when you're going to need it. And I think that's a great truth.
It's a great metaphor, that, isn't it, as well?
Absolutely, how we can do this. This, what we're sharing now is a technique which I love, because actually, I don't know about you, but sometimes where Mike shared that original picture of Sam just a bit disconcerted as a GP and just all over the place. And there are some consultations where you do just get all over the place, or we're all over the place just in our daily lives. And Bathe is, it comes out of a book, The 15-Minute Hour. I had it when it was version 2. It's now on version 6, still going strong. And it has great resonance in primary care, because it's really, how do you use psychotherapeutic techniques? I was trained a bit in that and then tried to fit it into 10 minutes. Couldn't do it. You can't. But this is the best we ever came up with, or I've ever seen, this book. And it also goes through some of the techniques and the whole person medicine, but also care for the physician. And the first rule is, do not take responsibility for things you cannot control. And the second rule is, care for yourself. So those are 2 rules that give you good things. But this Bathe technique is just, I like my acronyms where, spells Bathe. B for background. What's going on in your life? And I've been really surprised when people have come to see me with anxiety and other things like this, and they say, or back pain, or just they're not feeling right. And I said, what's going on in your life? And they say, well, I'm just about to separate from my husband. And as if they hadn't correlated the 2 together. And you think, well, that might have an effect on what's going on. I'm just, other things going on. My mother's just died. And then they just act as if they're surprised that this could actually be related to how they're feeling. So, but we can do that ourselves as GPs. I'm coming up to the issue of retirement and leaving practice. I need to recognize that. Family illness, my father-in-law's poorly, all of these things. There's background in the background, which we forget. Where are we in the things? And you can just ask patients, what's going on in your life? The second thing is the affect. How do you feel about that? Now, this is a type of thing we do in consultations all the time, but it just reminds us to ask about mood. These two are the crucial questions. T is what's troubling you the most? What about the situation troubles you the most? And it really helps them to form that thing, what's worrying the most? And sometimes you forget the strangest answers, or people would come up with thoughts that you weren't really aware of, but then they come in and say, this is what's bothering me. And then the H is absolutely the crucial thing. It's an asset-based approach. In other words, what's helping you handle that? How are you handling that? So you're working with their strengths. And that, to me, was a major change in my way I consulted, looking at asset-based approach rather than what's wrong. And then the last thing is this closing empathic statement. That must be difficult for you, or something appropriate to that end. So it's a B for the background, A for the affect. How do you feel about that? T for what's troubling you the most, H for how you're handling it, and E for the empathic closing statement. You can use it for patients, but I've also found this really helpful for me to recognize, where am I at? Where's my mood? I didn't, because we don't notice mood creeps up on us. What's troubling me the most? Prioritizing what I need to address, as Mike said, not pushing it down, noticing it, having a plan of how I deal with it, naming it. What are my assets that I'm handling it with? What works for me? We're all different. So what works for you isn't going to work for me, vice versa. And then being kind, that self-compassion. So that's a technique that I would recommend as a consultation technique, but also caring for self. So bathe ourselves regularly. I don't know what you think to that, Mike, but
I think it's brilliant. And I tell you what, this is when you apply bathe to self, you are grounding yourself.
Yeah.
And I think that's and your comment earlier about, there's sometimes the other thing that I think happens to us, when we're in a place of struggle and we see a client who is almost mirroring our own place of struggle, they come and say, Doc, I'm so stressed, work is overwhelming. And you sit there and you think, well, no joke, Sherlock,
Yeah.
It is for me too. And sometimes when we get ambushed by our experiencing mirroring that of what they're going through, it can be really disconcerting. And so we do need to be finding what works, why it works, and using more of it. And this, I think, does work. As it's a process of grounding, isn't it?
And I think, again, it's a type of thing you can use with those difficult patients where you're all over the place.
Oh, yeah, there's plenty of those.
Yeah. You and I know that, don't we, Mike? They've had plenty of experience. So let's the next slide. So that's one technique. The other thing that we're trying to promote is the feeling good app. This is an app that we've worked with Alistair Dobbin for years. So I've been working with him for over a decade, but the previous GP, his wife was trained in health education. And this is an app that's just gone from strength to strength. It looks a bit like it says on the left-hand side, there's a picture of kind of various tracks you can listen to. So it's basically an album, if you like, of good tracks. And you listen to the first track and then move on to the next one after you've listened to it 5 times. But it basically just grounds you in different techniques. And it's the good thing is, when we talk about mindfulness, some people find it hard because they're not in the right place and they have to fall awake to mindfulness. Whereas this is something you can literally fall asleep to, and it still will be processing in the brain, because your brain still is listening. The last sense to go is your sense of hearing as you go into unconsciousness. So you can still hear a bit, but it will give you then some visualization exercises that can help you and also positive things to say to yourself, so overcome some of our negative bias, and really gives you a grounding in how to be a little bit more positive and kind to self in self-talk and self-visualization. The great thing is it's free at the moment. So we've got the license for the whole of Northamptonshire, and there is a Teams version as well. So we will send out the details of this, but lots of resources are on the General Practice Alliance website, patient-facing resources. This is, and some of Mike's videos are there. So if you put in General Practice Alliance patient-facing resources, there's quite a lot of the resources are there, and the Feeling Good app is there as well. And we're keen that we just really promote it, and you can just send this to every patient you've got. You can text it, do what you want with it, but it's free to use. But have a go with it first, and lots of information on that is available. Very happy to people to come back to me on further information if you wish. Mike, what are your thoughts on this one? Because we've both used it personally, haven't we?
Yeah, and I think actually it's a lot. It's one of those ones that's developed and it's not like, we produce it and that's it. They've learned from what wasn't great in the beginning, and they really have improved it and made it a much more viable. And I think that what I really like about it is it also teaches you the clench technique for relaxation, which is a sort of form of self-hypnosis and a very evidence-based way of mind-body programming, so that if you do find yourself, you've done your 3-stage breathing space and there's still a bit too much visceral sort of physical tension in the body, it teaches you to find this clench technique, which is just, and you find that really lovely let go of emotion and the let go of and finding calm. I think it's really worth a very, very good look. And also, do you know those times when you're sitting there looking at a client and you're thinking, I'm not quite sure where, you said no to everything. I've tried that, didn't work. They won't have tried this. And it's a different way of working. So it gives us a degree of flexibility for what we can offer our clients as well.
Yeah, it is on, it's on the Wellbeing Launchpad on System 1. It's one of the things you can just print off direct from there, or you can use a QRX code to send it off. So that's
and we should all be using these things, shouldn't we, Dave? For ourselves.
Well, I think both. Yeah, I mean, I think this is a great thing with these techniques. They're both. We're all suffering from anxiety and a bit of tension at the moment. Who isn't, with cost of living, COVID, pressure of work, and everything else going on in the world around us. So I think these are techniques just keep us well, and they keep us grounded, and that's the great thing. And also, as a GP, for staff, you're an employer, £1 invested in mental health promotion, £3 gain, you improve staff retention and decrease staff going absent. So all of that is a good reason to think of how we can use all of these techniques and promote them. So the last slide really, is just to make sure that we're just aware, and you won't be able to read the BMA leaflet here, but we'll send out the slide, which just gives you, there's good information from the BMA, and there is a good number, but what they're the good 10 tips to help maintain and support, what you need to really be doing and taking care of yourself. So, check in with each other and just look after each other and your team. That's a really important point. And the senior staff, just to stay visible and just rotate staff. And then they've got some really good tips here, and their BMA number 0330 123 1245. And then in Northamptonshire, we have Stronger Together, which I know has been presented at the PLT, but that's northamptonshirehcp.co.uk/Stronger Together. And that's available for all healthcare professional staff. And that's really important, just to be aware of this for ourselves, but also we don't know when one of our staff or somebody around us in the healthcare partnership is going to say, look, I'm struggling. And it's just really important we reach out. I've had to go and get help a couple of times for my GP, and had therapy a couple of times just to get myself sorted. And I think no shame in that. It's just sometimes, shit happens, and it's how we deal with it. How we respond to things is what matters, and caring for self is a great way of caring for others. So I think that's the slides, but what we'd really love to do is to have some other chats, so if there's any questions, we appreciate, we're competing with football, so we appreciate that that our time is precious, but it'd be good to hear.
And that's the reference, how breath control can change your life. And it's a physiological correlates of just slow breathing. It's a really brilliant piece. I really, if you get a chance, have a look. It's brilliant. Yeah, as Dave said, any questions, any thoughts? And thank you so much for being part of it today. It's been lovely having people with us today.
Great to have so many.
And I promise I'll go on. I'll do it tomorrow morning, so I think I'll get more of a chance then. But I will refresh. Sometimes on YouTube, you just have to refresh some of the links. But I'll go on and do that. And years ago, I wouldn't have been techie enough to know what to do, but I do now. So with age has come some wisdom.
Every day is a learning day, isn't it, Mike?
It is.
So, I mean, I think thanks, Mike, for those thoughts. They're really helpful, as always.
Yeah, thank you. And it's been really enjoyable sharing with Dave tonight. It's good at a bit of a team approach, which is the best way. And thank you, Sadiga, for that. We've enjoyed it as well.
Yeah, that's been good.
Lovely. I'll stop recording now so that if there are any questions that people would like to ask anonymously, that you can do that. So I will stop the recording